Hi, my name is Amy Bernard, and I am an assistant professor on the CU Anschutz Medical Campus in the Department of Immunology. And I am an immunologist. And today we're going to talk about SARS-CoV-2, which is the virus that causes COVID-19. So what is SARS-CoV-2? Well, it's a new virus that belongs to the coronavirus family, and it causes the disease COVID-19. So SARS-CoV-2 stands for Severe Acute Respiratory Syndrome Coronavirus 2, and it causes COVID-19, which is coronavirus infectious disease from 2019. It has this naming of SARS-CoV-2 because it's genetically similar to the SARS coronavirus that caused an outbreak in 2002. Again, it's a new virus from the coronavirus family, so that means it's newly emerging, and it's less pathogenic than some of the coronavirus strains that are responsible for the common cold. If we look at this cartoon or schematic of the virus, you'll notice that on the outer membrane or the outer capsid of the virus, there are a lot of shapes kind of sticking out. I'll draw your attention to this green shape here that's labeled S. That's the spike protein. That's what's responsible for binding to the receptor on the target cell. And in humans, the target cell are respiratory cells, like lung cells, that have something on their surface called an ACE2 protein. If we also look at this RNA virus schematic, you'll notice that the genome, or the nucleic acid for this virus, is a single-stranded, it's a positive single strand of RNA. So that's the nucleic acid for the virus. You know that our nucleic acid is double-stranded DNA, but viruses can have different types of nucleic acid. So in this case, the virus is a single-stranded positive sense strand of RNA. And of course, there are other proteins on the surface as well of the virus, but we're really just going to stick with talking about spike protein because that plays a role in targeting the host cell, those respiratory cells, the lung cells. So again, SARS-CoV-2, the spike protein binds to ACE2 on target cells. That allows the virus to get into that target cell. So that ACE2 protein, that is what the virus is specific for. So it's only going to bind to cells that express ACE2. So if there's a cell in your body that doesn't express ACE2, SARS-CoV-2 will not bind. It can only bind to cells that have ACE2 on their surface. This binding allows for the virus to get inside through a cellular process called endocytosis. What happens then is the virus releases its RNA, so its nucleic acid, into that target host cell, and the cell machinery is going to start to use that viral RNA to make more viral proteins. And this is a process called translation, where messenger RNA, which is a positive sense strand, single strand of RNA, is read by ribosomes in the cell to make protein. So the virus is taking advantage of that cellular machinery to make protein for the virus. I call that cell jacking, that viruses actually take over the host cell, kind of like if someone, steals a car. So the viruses here are using that host cell to make more virus. So hundreds, if not thousands, of baby viruses or virions are being produced, and they're going to then be released from that infected cell to go and infect neighboring cells, so cells in the area. Oh, and by the way, what we just talked about, the cell binding, entering, taking over the host cell, and exiting, that's called the replication cycle of the virus. So how is SARS-CoV-2 spread? Well, we know now that it's primarily spread through salivary droplets, and this can happen when people cough or sneeze or even breathe really heavily, because these aerosolized droplets can remain in the air for up to 3 hours. So we see this cartoon, this individual that is infected with SARS-CoV-2, has the disease COVID-19, is coughing. Those aerosolized droplets are in the air, and if they land on the T-zone of this individual, this cartoon woman, so if they land on the eyes, nose, or mouth, that virus will get in and infect this woman. And AJ thinks that she should be wearing a mask. AJ is my dog. And we'll talk about mask wearing here in just a minute. SARS-CoV-2 can also survive on surfaces for extended periods of time. You can see all these different surfaces here. It seems like plastics are where it tends to survive the longest for up to 3 days. What's best to do is just to wash any surfaces that you're using, or just wash your hands after you touch things that you think might have virus on them. So let's talk about the reproductive rate of a virus. This is something that epidemiologists, these are scientists who study how diseases are spread. So the reproductive rate is a term that they use for how contagious is a disease, how quickly does it spread. So let's talk about that. And this R naught, it looks like a R, like subscript 0, we call that R naught. An R naught of 1 is where if you have one infected individual, that person will only infect one other person. An R naught of 2 is where you have one infected individual, and that person infects 2 other people. So that's, and that there's a lot of complicated math that goes into that, but that's how we figure out the R naught. So let's look at the contagion here on a graph. So again, if the R naught is 1, it'll probably stay about the same because one person will infect one other person. If your R naught is below 1, then the disease will eventually fade. And if your R naught is above 1, it's going to continue to climb and infect more people. So let's compare on this graph influenza, the annual influenza R naught with COVID-19. And what you can see here is the R naught for the typical year of the flu is about 1.3. So for each infected person, about 1.3 people will be infected. Again, complicated math. And then for COVID-19, it's about a 2 to 2.5. So we know COVID-19 is more contagious than the flu. So what are some common symptoms of the COVID-19, the disease? As you'll see here, the most common symptoms are fever, dry cough, and fatigue, as well as some other less common symptoms below, like sore throat, headache, chills, maybe shortness of breath, muscle ache, joint pain, stuffy nose, all those things. So how is it diagnosed? Well, there's a lab test that's called an RT-PCR, that stands for reverse transcriptase polymerase chain reaction, and that's kind of a complicated term, but what this means is that we take a nasal swab sample to look for RNA. So we look for virus, that the genome, the nucleic acid of the virus, we look to see if there is virus in that nasal swab sample. So are there different levels of severity? Yes, there are, absolutely. And here are the 4 levels of classified severity, going mild, moderate, severe, and critical. You can see with mild, it would be like a low fever, a dry cough, some muscle pain, some joint pain, maybe stuffy nose, headache, or sore throat. Critical, all the way to critical, respiratory failure, shock, and multi-organ failure. So much more serious. And then you have moderate to severe. You would have more and more escalating or severe symptoms as you go. Are there certain risk factors that contribute to disease and disease severity? And the answer is yes. What you'll look at here is age can be a contributing factor. Obviously, the younger you are, the less likely you are to become infected or have severe disease. But the older you are, the more severe disease you can have. So 60s and over, we have more disease. They're more likely to become infected, more likely to have severe disease. And then there are certain things that contribute to their infection. So certain health conditions that people might have, like blood pressure problems, like hypertension or diabetes or heart problems or lung problems or maybe even cancer. And one thing we know is that as people age, they do have more health conditions. So these things kind of go hand in hand. So my favorite part, how does our body fight disease? How does it protect us from infection? Well, that is the immune system. And you can think of our immune system as the military or the defense for our body. And there are really kind of two arms for the immune system. There's the innate immune system and the adaptive immune system. So let's start with the innate immune system. This is composed of cells that act as our first line of defense, and they're going to defend us from any pathogen that comes our way immediately within a few minutes. So what triggers the innate immune system? Well, one thing that can trigger that is viral replication, and that's going to trigger inflammation, which is really the recruitment of more immune cells to that area of infection. And the immune cells are recruited there to help fight infection. Sometimes, though, it's important to know that your immune system gets a little bit overexcited, and sometimes too many cells can be recruited to the area. We've seen this in some patients with COVID-19. They have an overabundance of immune cells in the lung, and that's going to cause some breathing problems and maybe even some long-term damage. These immune cells that are recruited to that site of infection, they also have a lot of different jobs. And one of the things that they're going to do is to release chemical mediators. And some of these chemical mediators are called cytokines. And they coordinate and regulate immune responses. And we have actually tens of different types of cytokines, I think up to 200 different cytokines. They all have slightly different jobs, some of them overlapping. But if we have too many cells there, sometimes a lot of these cytokines are released and we'll have something called a cytokine storm, and that can also cause problems. And we've heard a little bit about cytokine storms with patients that have COVID-19. So sometimes we see that the immune system is trying a little bit too hard to fight the infection, and that can sometimes cause problems. However, keeping in mind the immune system is really just trying to defend us, so it's doing its best. Sometimes it just gets a little bit overexcited. Now, the adaptive immune system is a little bit different. It's a more specialized line of defense. It takes a little bit more time to fight the infection. Often the adaptive immune system needs to be activated to kind of come on board. And this often takes 7 to 10 days to get started to kind of join that fight. In the cells of the adaptive immune system, the two major players are T cells and B cells. There are a lot of different types of T cells, but the main type that you will likely hear of is something called a CD8 positive or cytotoxic T cell that we like to call killer T cells. These types of cells, these killer T cells will kill infected cells. So they'll kill virally infected cells. So that's a really important job. And then B cells are another adaptive immune cell. These guys are important because they make special proteins called antibodies, which you've probably heard of. And these antibodies are proteins that are released into the blood, and they go off and fight infection. So they'll help to clear the pathogen from our blood as well. So all of these two arms of the immune system work together to defend us, the innate immune system and the adaptive immune system. And then one really important aspect of immunology that I want to talk to you about quickly are vaccines. Vaccines are an amazing tool that we have that will help to provide long-term immunity. What they do, so a vaccine is really a non-harmful form of the pathogen that gets injected into our body. So like a non-harmful form of SARS-CoV-2 gets injected. And then our immune system gets to have like this practice run. It gets to like build up its immune military to fight the infection. And what's the most important thing about vaccines and how the immune system works with vaccines to protect us is that T cells and B cells make memory. So they will make memory cells. And these memory cells will stay in our body for years and years. And if we see the actual pathogen, like the real life pathogen infects us, and we have memory to it, those T and B cells are going to get started right away, and they're going to protect us from disease, and we're not even going to know that we have been infected because we have that long-term memory. So your immune system, or vaccines, work with the immune system to provide long-term protection. So I'm really excited about a vaccine coming out for SARS-CoV-2. I'm going to be one of the first people in line to get it. So what can you do to stay safe besides rely on your immune system? Well, we know how it's spread. It's aerosolized. So what you can do is cover any sneeze or coughs. You can wear a mask, especially when you're around other people out in a public place, particularly with people you don't live with. You can wash your hands frequently. You can stay physically distanced when you go into public places. So 6 feet apart or more would be most advisable. And then also disinfect and clean the places that you are as frequently as you can. So one more thing I wanted to talk to you guys about that we've been, I guess, talking a lot about in the healthcare community is something called flattening the curve. And what this is where we're spreading disease over time. So what you'll notice here, if you look at on the y-axis is number of cases, on the x-axis is days since the first case, and as time goes on towards the right, what we're looking to do is to take the curve and actually flatten it, meaning we're spreading disease out over time. So this purple bell-shaped curve is with the pandemic outbreak with no intervention. You have this large spike in cases. If you flatten the curve, you're going to spread the disease over time, and you're going to have less cases over a longer period of time. So actually, that's not true. You might have the same number of cases, but you're spreading them over time. So why do we do this? Why don't we just get it out of the way? Well, it's important that we don't do that because we need to make sure hospitals are available to cope with all of the people that are infected. So if we have a huge spike in cases, hospitals are going to be overwhelmed. Healthcare is going to be overwhelmed. We can't take care of all the people that are sick. So if we flatten it, hospitals will remain able to take care of people, and we'll also have enough resources for the people who need them. So personal protective equipment, or PPE, for healthcare providers, and like ventilators and medicine for the people who are sick. So it's that flattening the curve is really important to helping us take care of the people who are sick. And think about taking care of grandma and grandpa. We want that curve flattened so that if they get sick, there's enough room in the hospital for grandma and grandpa. Okay, so now that we know a lot about SARS-CoV-2 and COVID-19, here are some additional videos and websites you can look at. So this osmosis series, a lot of good videos, a lot of them for free. Centers for Disease Control has a lot of good information and videos, and then World Health Organization. And I would also recommend these TED Ed videos on COVID-19. They're pretty basic, but pretty good. So thank you very much. And here is a picture of me and my dog, AJ, wearing masks to prevent us from becoming infected and infecting other people. So with that, I will say thank you very much and enjoy the rest of your day.